Hello, everyone, and welcome to Ask the Blood Detective. The topic of today's podcast I've called Bloodwork Breakdown. It's basically about how to read your blood work medically and nutritionally. My name is Dr. Michael Wald, and welcome back to this particularly important conversation about truly being your own blood detective. Now, when I say that, being your own blood detective, I don't mean taking the place of a health professional's education and experience, but to add to it. And I say that basically because an educated consumer, of course, makes better healthcare choices. And the other thing, which is just a reality, is that doctors miss things. They miss obvious abnormalities. I can't even tell you how many times over my 30-year career I've sat with clients and I've asked them about their lab work, and they said, well, I suppose it's normal because the office didn't call me back. And I always stress to them to get copies of their labs anyway. And when they do, inevitably, most of the time, there are blatant abnormalities that are just missed. And we're not just talking nutritional ones. I've seen iron anemia missed, but I've also seen abnormalities in various labs that suggest chronic disease. So, and another problem is that in the background, in terms of when you have blood work done at a medical office, sometimes the doctor themselves don't even read the lab work. They push it off to a nurse or a nurse practitioner or a physician assistant. And I'm not saying that these individuals don't have knowledge in labs. They do have some knowledge in labs, but we don't want to rely just on the medical team for the reasons I've discussed and for some other reasons. So why should you even care about blood work? And before we get into that, once again, I just want to give you a quick rundown of who I am. Again, my name is Dr. Michael Wald, the original blood detective, and I practice in Westchester, New York, which is about an hour north of New York City. You can reach me through my phone at 914-552-1442. And you can email me your show topic ideas, your questions about this presentation and others at info@blooddetective.com. And there's lots of free content in the form of podcasts and videos and text on my website at drmichaelwald.com. That's drmichaelwald.com. So we're getting into blood work and why you need to know something at least about your laboratory work so that you can enhance the medical experience and you can find hidden problems or problems that were just missed. So, basically, we want lab work for a few fundamental reasons. Number one, we want to take advantage of early detection. Without blood analysis, early signs of disease such as diabetes, cancer, and various anemias can go undetected. That can lead to delayed treatment and poor outcomes. So people just don't get their labs done often enough. Also, the laboratory work you get from a particular medical specialist may be limited to their specialty. People often say to me, Dr. Wald, well, if there was a problem with my labs, wouldn't my doctor have found it already? They did so many labs. They did every lab test. I've actually had clients tell that to me, that their practitioners have done every lab test, which of course is nonsense. I'm also the author, you should know, of a 500-page textbook on how to both medically and nutritionally read labs, and you want to know something about both. So we mentioned, number one, that early detection is clearly important. We don't want to be dying of diseases that we can detect early. That's a fact. Next is, lack of prevention opportunities. Regular blood tests identify risk factors for various diseases, as I just mentioned, allowing for you to be more proactive and take proactive measures to prevent the development of diseases. And then another reason to consider regular lab work is to manage and identify unidentified underlying conditions. Blood tests can reveal underlying health issues that may not be present or manifesting as noticeable symptoms. Another, disconnect that I notice with some of my clients, a good majority of them actually, is that they think that if they're sick, they'll generally have symptoms. I've had patients with metastatic cancer, let's say, throughout their bodies, and they had no symptoms. So the lack of symptoms does not mean health. If you feel healthy and your labs look great, then you probably truly are healthy. If you feel well and your labs are not so good, there's probably some underlying health issues there. Another problem with the medical approach to many health conditions is that they don't always look for underlying causes. I mean, I literally just got off the phone before taping this podcast with a woman who was clearly very frustrated because she has a chronic skin condition and she's tired of using topical steroids. And no one's looked to see, is the skin condition autoimmune? Is it nutritional? Is it allergic? So again, she knew enough to say, I need to go outside of traditional medical interventions and look for causes. And the only way you're going to do that are doing labs. And her dermatologist had never done lab work on her. And most of you who've gone to dermatologists know that they hardly ever do that. Another reason for laboratory work is and being able to read it, at least to some extent, is you want to make sure that, again, without blood work, individuals must rely solely on their subjective symptoms. And as I mentioned, that can lead to potentially overlooking very serious health concerns. And then there's delayed treatment planning. Without the insights provided by blood tests, healthcare providers of different types may have limited information for developing effective treatment plans. So the basics of what you need to know is that regular blood work checks, in other words, analysis of laboratory work, plays a crucial role in maintaining your overall health, preventing and treating diseases, and also promoting longevity. By periodically analyzing blood, doctors can identify potential health issues much earlier, as you can too if you stick your nose into this process, and that allows for timely interventions and treatment. So now we're going to discuss the various benefits of regular blood checks, emphasizing the importance of early detection, disease prevention, and overall well-being. But before I do that, I want to mention something very important. A good number of people in my 30-plus years career as a clinical nutritionist with a doctorate in nutrition, I might as well give you the rest of my credentials right now. I have a chiropractic degree. I did go to medical school. I graduated medical school. I earned my MD diploma. I decided not to get an active license in medicine and pursue that, but I do have that knowledge, obviously. I am a dietitian. I'm a life coach. I'm trained in acupuncture. Why would I do all of these things? I do all of these things because all of this knowledge adds to what I bring to the table. Now, what I'm trying to get at here is that there are healthcare providers, some with credentials and some that are not credentialed. But let's say the credentialed ones, like dietitians or certified nutrition specialists, they are not trained in laboratory interpretation. And if they take a course in laboratory interpretation, well, that's fine. But they have no right, I should say, to read laboratory work or order laboratory work. It's out of their scope of practice. Look, laboratory work is a very difficult area. Now, you as a person in the public who's concerned about your health as a healthcare consumer, I'm not saying that you will learn what I know in labs, but you can learn enough to know if something's missing on your labs or if something was misinterpreted to a large extent. And look for my book next year, which is meant for the lay public on how to medically and nutritionally read their laboratory work. My 500-page textbook is a bit technical, so I wouldn't suggest that for the average listener. But beware of healthcare providers, natural or unnatural, that have no credentials or scope of practice due to their license limitations to order lab work. Now, many laboratories, nutritional laboratories, regular medical laboratories like Quest Lab and others, they might actually allow some unqualified healthcare providers to perform labs. And why do they do that? Because they make money. And they think that their liability isn't there, but it is. So again, you want to go to qualified people. So what is a benefit of laboratory work? One is early detection of health issues. Like I said, one of the primary advantages of regular blood work is the early detection of health issues. By analyzing blood samples, doctors can identify abnormalities in various components of your blood, such as cholesterol levels, blood sugar, and other vital markers, let's say, of nutrition. So this early detection enables healthcare professionals to initiate appropriate treatment plans, ensuring that health issues are addressed before they become severe. So early detection. The next benefit is prevention and treatment of disease. Regular blood work checks also help in the prevention and treatment because They can reveal the presence of infections or the presence of specific antibodies. They may indicate underlying disease. And early detection of such conditions allows for prompt intervention, and that, of course, reduces the risk of complications and promoting a more effective treatment outcome. Now, how often should you have your labs performed? Well, this depends on a couple of factors. I can't name them all in this short podcast, but I will tell you that, for example, if you have abnormally high cholesterol and treatment is begun, whether it's natural treatment or medications like a statin drug, most health professionals will suggest that you have your cholesterol checked again in around 8 to 12 weeks. So that's reasonable. But if you've had a few heart attacks in the past, maybe every 2 weeks. So it depends on the condition you have. Are you on any certain medication? Same thing with, are you on any nutritional supplements or any other dietary interventions or exercise interventions? So the entire picture of what your abnormalities are, and you may have a combination of them, and they may need to be rechecked at different intervals. So that's as much as we can really say about that at this point in our conversation. So we talked about early detection is a benefit of having labs done. The next is prevention and treatment of disease. Number 3 is monitoring chronic health conditions. Many people fail to monitor their health problems, and they end up either dead or with worse health problems. I had a woman who had colon cancer, and it was seemingly successfully treated. So she decided not to have her next suggested follow-up that her medical physician had recommended. And lo and behold, her cancer came back, and she died of it prematurely. So we want to have our health conditions, particularly chronic health conditions and acute ones, monitored appropriately. The other benefit of routine blood work checks is that it helps maintain overall health by identifying potential nutritional deficiencies and imbalances or other health problems. So by analyzing blood samples, doctors can recommend appropriate dietary and lifestyle changes to ensure basically optimal health. And the other benefit, the fifth benefit, is longevity. Regular blood work analysis contributes to increased longevity by promoting early detection and treatment. End of story. It just does that. So by identifying and addressing potential problems early on, individuals can enjoy a higher quality of life and extend their lifespan. So what do we know? We know that regular blood work checks are essential for maintaining good health, also help us in prevention and treatment of disease, and promote longevity. So by identifying potential health issues early on, these various lab tests enable healthcare providers, qualified healthcare providers, to initiate appropriate treatment plans, ensuring that you and other individuals receive the best possible care. So let's discuss the role of nutrition and laboratory testing and who should be interpreting and ordering nutrition tests. And importantly, why don't your medical physicians routinely order nutritional tests? Well, I think I have some of the at least part of the answer for that. It has to do with the average hours of nutrition education for medical students. You know, the average hour of nutrition education for students, medical students, does vary widely across different medical schools, but does not exceed 27 hours on average. That's it, 27 hours. However, studies have consistently shown that the amount of nutrition education that's provided to medical students is insufficient to adequately prepare them to recognize and treat issues related to disease treatment, prevention, and to promote longevity. Now, in the United States, there was a survey conducted by the National Academy of Sciences, Engineering, and Medicine that found that the median total hours of nutrition education in the U.S. medical schools, can you guess it? It's only 19.6 hours. 19.6 hours, that is it. So these number of hours significantly falls short of the 25 hours that are recommended by the National Academy of Sciences, which is already considered inadequate by many experts. So the National Academy says 25 hours. We say that's inadequate, and medical schools have 19.6. Why do they have so few hours? Well, there's a lot of reasons for this. There's also historical reasons that nutrition, when it first started to take off early in the 19th century, was considered something that women did. Women did most of the cooking. That was the nutrition. So when nutrition got into college universities, land-grant colleges, it was considered not something that a serious science student would take, let alone a medical student. So part of it is due to that. Other reasons are, for example, just bias. And if the people making the decisions don't know nutrition themselves, why would they add nutrition to a medical school curriculum? The answer is they do not. And then there's just inadequate, the inadequacy of nutrition education for medical students has been a topic of concern for many years. Despite the well-established link between diet and chronic diseases such as obesity, diabetes, cardiovascular disease, and certain types of cancer, medical students often receive minimal training in nutrition. Now, this lack of education leaves them, I should say, putting it mildly, ill-prepared to address nutritional issues in clinical practice. Furthermore, students have shown that, or studies, I should say, have shown that medical students themselves perceive their nutrition education as inadequate. They themselves somehow know it's inadequate. And there was a study that was published in the Journal of Biomedical Education, and it found that 94% of medical students surveyed felt that their nutrition education was inadequate. This sentiment was echoed in another study published in the Journal of the American College of Nutrition, where they say that 80% of medical students reported feeling inadequate or inadequately trained to counsel patients on nutrition. So what is the impact on disease treatment, prevention, and longevity given this lack of education? So the insufficient nutrition education received by medical students has significant implications for disease treatment, as I mentioned, prevention, and efforts to promote longevity, because without a solid understanding of nutrition, doctors are going to struggle to effectively counsel people, that's putting it mildly, on dietary changes to manage or prevent chronic disease. And for many conditions, folks, what is called the first-line therapy of those conditions should be lifestyle, which includes diet and sleep and reduction of stress, possibly the intake of nutritional supplements and other lifestyle factors. But moreover, as the field of precision medicine continues to advance, personalized dietary recommendations based on an individual's genetic makeup and health status are becoming increasingly important, but also because the rates of most diseases are on the rise. Without adequate nutrition education, doctors lack the knowledge and skills needed to incorporate personalized nutrition into their practice, and thus they cannot deliver it to patients. So what would they say when you ask them about nutrition? They will get angry, they will get upset, they will get defensive because their little tiny egos do not like to not know something or to be told what they should be doing. I would love for my clients to say something to me about any topic that if I don't know it, I will be happy to admit that and then become competent in that area. Most of you probably have heard of the term cognitive dissonance. Now, scientists, physicians, they are scientists, and what we're supposed to do as scientists is that when we learn new information, it should be incorporated into our body of knowledge. And if that means that we were wrong before, we were wrong before. But as common sense as this sounds, many physicians and doctors and nutritionists, they suffer from cognitive dissonance. They stick to their guns and their belief systems that they've practiced for years and years, and they do not change. So by definition, they are not scientists. They are not practicing a scientific method. And the scientific method includes in its definition incorporating new information and adjusting the current thinking in particular areas, and that's how progress happens. So now let's talk about clinical blood ranges compared to healthy blood ranges, because folks, when you are getting laboratory work and you have those results on that piece of paper and it shows your cholesterol levels and your sodium levels and your potassium levels, etc., you are compared to ranges. And those ranges are called clinical ranges. And those are not what you would think. So before I tell you what that means, for those of you just joining us, welcome. My name is Dr. Michael Wald, and you're listening to my podcast, Ask the Blood Detective, which you can find on any podcast platform. Just look up Ask the Blood Detective. Today's topic is Bloodwork Breakdown, how you can learn how to be your best advocate, your own blood detective, work better with your healthcare providers so you can prevent and treat disease best and hopefully promote longevity, which means you might live longer, but we want you to live better during your life. So, clinical blood ranges. What do we mean? So, as a clinical nutritionist and blood detective, I often analyze blood test results to assess a patient's health status. Clinical blood ranges refer to the values within which most people's test results fall. These ranges are established based on the results of a large population, usually, of apparently healthy people. So when interpreting blood test results, it's absolutely crucial to compare an individual's results, like your results, your blood test results, or results of other tests, to the established clinical ranges, but keeping in mind that the clinical ranges are comparing you to seemingly well people. For example, if you go donate blood and they check the blood for HIV and they'll check the blood maybe for Lyme disease and a few other things, as long as you don't have those issues going on, your blood will be tested, and it will be tested for practically everything you can think, from cholesterol to magnesium, you name it. And then there's an average that's produced. But have you thought of the health of the average person? Not so healthy. So why would we want to compare ourselves to seemingly well people when, as we said earlier in the podcast, that these well people may not have symptoms, but they can have all manner of disease. A lot of them might be communicable through blood, and you wouldn't know. The point, though, is that not only do you want to keep in mind that the clinical ranges are not based on healthy people that have been definitively determined to be healthy, but seemingly healthy people. And we're going to speak about in a few moments what it means to be compared to healthy ranges. Healthy ranges, by definition, are ranges of labs where studies have shown if your labs stay within these ranges, more or less, that you will have a longer lifespan, most likely, because you will not die prematurely of diseases that could be picked up much earlier. Okay, we're going to talk again more about this in a moment. So when analyzing blood tests, I consider whether the values fall within the established clinical ranges. I'm just reiterating here. We want them to certainly be in the clinical ranges. That's the first scanning that you want to do. If a result falls outside of these clinical ranges, it might indicate a potential health issue or imbalance. For example, if a person's cholesterol levels exceed the upper limit of the clinical range, which is 200, it could suggest an increased risk of cardiovascular disease. If they're less, let's say, than 160 in their cholesterol, that may indicate an increased risk for cancer. Yes, you heard it right. Low cholesterol may be an indicator of cancer, and high cholesterol, heart disease. But there's many things that can raise cholesterol or can lower cholesterol that might mean completely other problems. Another example, if your blood glucose levels are higher than the upper limit, that might indicate prediabetes or diabetes. And if it's lower than the clinical range, lower end limit, that might indicate low blood sugar or hypoglycemia. Now, those definitions just mean that a person has high blood sugar or low blood sugar, hyperglycemia or hypoglycemia. It doesn't speak to what are the potential causes of those findings. And that's something that a trained clinical lab expert can help determine. So it's important to note that while the clinical ranges do provide a general guideline for assessing health, those are the ranges that your regular doctors use, the clinical ranges, they may not necessarily reflect optimal health. This is where the concept of healthy ranges came into play. And this occurred to me like a lightning bolt around 25 years ago. And then I started to research on my own what the healthy blood ranges should be. And of course, there are others that have been doing this around the world as well. So later on, in a few minutes, I'll be giving you several real examples of tests you must know. I'm going to teach you how to interpret them both clinically and both from a healthy range perspective, and why and how those healthy ranges are truly better than the clinical ranges. So in my practice as the blood detective, I emphasize the importance of striving for optimal health rather than simply falling within the clinical ranges. So healthy ranges, as defined by me, take into account not only the absence of disease, but also the achievement of vibrant health and well-being. In order to do that, we can't merely compare our labs to clinical ranges. We need to go further. No different than if someone wanted more than the average, let's say, strength of their legs, as opposed to if they wanted exceptional strength, they would have to do things differently than those who just want legs that get them around. The same thing with the labs. If you want optimal health, you need to get your blood work in the optimal ranges, plain and simple. I'll give you another example. For instance, when the clinical range for vitamin D levels, it's set at 30 to 100 nanograms per milliliter, 30 to 100. I consider optimal levels to be between 50 and 80. So we know, because there are studies, there are meta-analyses studies, which are studies of the best studies put together and what they actually mean, which say the higher normal your vitamin D level, the lower your risk of dying of anything. That's a big statement. So we want to be 50 to 80, more on the near the 80 end. But your doctor might consider your vitamin D level on a different scale, which they do, 30 to 100. And if you have a 30 or 31, they won't look at it twice. And you might say, well, how would they miss that? Well, they do. They just clearly don't know about the meta-analysis studies or any of the studies that show that there are optimal ranges of labs. But things are changing. For example, until about 5 years ago, roughly, something like that, the LDL cholesterol, that's considered a bad cholesterol. The LDL cholesterol was considered normal if you were 130 or below. But now your blood test will actually say, written on the blood test, what I just mentioned, if you're 130 or below, it's normal. But if you're lower than 100, that's optimal, which means less disease, longer lifespan, or at the very least, longer health span, living longer without comorbid conditions or as deadly or devastating as they can be. Similarly, when evaluating thyroid function, there are clinical ranges for the TSH, that's the thyroid stimulating hormone, between 0.4 and 4.0. So 0.4 and 4. But I aim at 1 to 2. So I aim at 1 to 2, and the clinical ranges are 0.4 to 4. So the 0.4 shows that the regular clinical range has twice the limit at the high end at 0.4, because I have 0.2, and 0.4 is twice 0.2. We know if we're in a tighter range with TSH, 0.1 to 2, there's much less risk of deadly cardiovascular disease and stroke. Not to worry if you didn't quite get that. We're going to reiterate this in a moment, so hang in there. So let's talk a bit more about comparison of clinical and healthy ranges. Before I do, you're listening to Ask the Blood Detective, and today's show topic is Bloodwork Breakdown. We're discussing how you can use laboratory work to help yourself and your loved ones by having a clue about lab tests. We've discussed why lab tests are important. We have discussed there are clinical ranges and healthy ranges. We've discussed that medical physicians are inadequately trained in nutrition, so they cannot read lab for nutrition, sometimes even the most basic nutrition like an iron anemia. My name is Dr. Michael Wald, the Blood Detective. You can reach me by calling 914-552-1442. If you want to schedule with me as a client, you can do that by emailing me at info@blooddetective.com, info@blooddetective.com. And please check out all the content, the free content on my website at drmichaelwald.com, drmichaelwald.com. So the key distinction between clinical ranges and healthy ranges lies in their interpretation. Clinical ranges serve as broad guidelines, because they're wider ranges, folks, right? For identifying potential health concerns based on statistical averages within a population. In contrast, healthy ranges are tailored to optimal and by comparing people to tighter ranges where the medical research demonstrates that there's a higher propensity for health and less disease if you stay within these ranges. Those are the healthy ranges. I mean, think about it. Why do you think so many people are diagnosed with devastating diseases, and a lot of times they're late in the disease? Currently what's happening is King Charles was recently diagnosed with cancer, and he's royalty. So it either means that his physicians are inadequate, to say the least, or they're not inadequate, but they look at Charles like they look at everybody else by comparing him to regular ranges. Here's something I haven't mentioned yet that you need to understand. Regular clinical ranges, the high and low end, are situated like that to detect disease once it's at a certain level. Let's say 40%. So, for example, your thyroid function testing will tend to remain normal until you lose 30 to 40% of the thyroid function. Then the sensitivity of the thyroid testing may pick up the problem at that point. It's just the limitations of the range. But if we have a range that has a lower end and also a higher end that's not quite as high, so it's more controlled, such that if you lose 20% of function and you compare yourself to these healthy ranges, it will show things and show problems earlier so you can do something about them. Clearly, that's what's needed. At least that's one of the things needed in proper interpretation of laboratory work, such that the laboratory work ranges are consistent for the goal of superior, I should say, detection, prevention, and treatment, where the clinical ranges are just too wide. And because they're too wide, they tend not to pick up things until it's too late or they're in later stages. And by comparing an individual's blood test results to both clinical and healthy ranges, that helps me provide much more personalized recommendations for achieving optimal health. Better dietary recommendations, better nutritional supplement recommendations, and also it allows for me to check whether or not all the other lifestyle recommendations, like the exercise recommendations I give people, are working well. So in summary, while clinical blood ranges provide valuable reference points for assessing health status, healthy ranges take into account a broader spectrum of factors and pick up disease earlier than do clinical ranges. Okay, now the fun part. I'm going to give you several laboratory tests that you need to know about. And I'm going to give you their clinical ranges, what you might also call normal ranges, and then the healthy ranges, which are optimal ranges. So for example, with TSH, thyroid stimulating hormone, the normal range is 0.4 to 4, as I mentioned earlier. We really want to compare your results of TSH to 0.1 to 2. In other words, if you have a 2.5 on your TSH, which is 0.5 out of the optimal range, that is a problem. If you have TSH that's less than 1, let's say 0.9, that is a problem according to the optimal ranges. But those problems that are picked up of the optimal ranges would not be abnormal if you compare them to your normal clinical ranges. Do you see what I'm getting at here? Let's give another example. I mentioned this again to reiterate. Cholesterol. A cholesterol less than 200 is considered normal. But for the optimal range, I define it as if you're anything above 180, you've got a substantially increased risk of cardiovascular disease. But in regular medicine, they would wait until you have a 201 or greater to do something about it. LDL cholesterol. I mentioned that 130 or less is considered normal, but optimal is less than 100. So that means that I want an optimal range of someone's LDL cholesterol to be 70. But if you had a normal range, in other words, a clinical range of 100, I would consider that abnormal. But if you were 100 or less, let's say 71, 80, 90, those are still considered normal within the normal ranges, but another example would be HDL cholesterol. Think of the H as happy cholesterol. The normal range or clinical range for HDL for men is 40 to 60, and for women is 50 to 60. The optimal range, based on studies of where there is less disease with HDL levels, is such that the optimal range is above 60 milligrams. So you want it above 60. Your doctor will be fine if you're a man, if it was 40, 41, and if you're a woman, it was 50, 51, but again, inadequate. And this interpretation, which is perpetuated by these clinical ranges and utilized by all physicians across the globe, is, in my opinion, inadequate And it is a model and a standard which is comparing people to the wrong standard. And as a result, we have this overwhelming rate of increase of diseases across the board. Clearly, our standards need to change, which is why I came up with these clinical ranges. And then there's another test. And before I go to that one, just to remind you, TSH should be done on every test for thyroid function. It's the most important of the tests. Cholesterol and LDL and HDL. Now we're going to get into something called ferritin. Ferritin, for those of you who haven't heard of it, is a test which is considered an accurate marker of iron storage, because ferritin is a type of iron bound to a protein. And also, you should know that if ferritin is elevated, that might mean that a person has too much iron intake, or they might have a genetic condition where they store iron excessively, called hemochromatosis. So it's hemochromatosis if there's a genetic glitch that causes high storage levels of iron in the body. And then there's hemosiderosis, which is basically the same condition, except it's not genetic. It's someone just consuming too much iron and or having too much iron in their body relative to the rate at which the body excretes the iron. So it's just too much. Also, ferritin can be elevated when it has nothing to do with iron. It could be elevated because of inflammation. So that's beyond the scope of today's talk to distinguish whether or not an elevated ferritin is from inflammation or it's from too much iron. But what you should know about ferritin is that the normal range for men is about 12 to 300 and women about 12 to 150. So they seem to know there's a difference in optimal values for men and women. The optimal ranges for ferritin is 80 to 150 for both males and females. So if you think of the range that I have, which is 80 to 150, which is the optimal one or healthy one, if you compare that to the normal for men, if they have 150, 200, 300, they're still considered normal, but anything over 150 is considered abnormal to me. The earlier you identify iron storage or the earlier you identify inflammation, both of which could be what the elevated ferritin means, the better. That's why these tighter ranges are better. And then there's a very important test called homocysteine. Homocysteine is basically considered a toxic protein, and the normal range is 5 to 15. But the clinically, I should say the optimal healthy range is 7 or below. That's what the studies say a better outcome in particular disease occurs. In other words, if you have a history of cardiovascular disease and your homocysteine is a 7 or below, you have a much better outcome. But with the regular normal ranges, they give you to 5 to 15, which is absolutely too high based on the literature. I don't just make up these optimal ranges. I base them upon studies which have looked at these ranges and where and what the best ranges are that predict and help assess how someone's doing with their disease. So again, with homocysteine, we want it a 7 or below. Vitamin D3, I mentioned earlier, normal range is 30 to 100. The optimal range is 50 to 80. You want to keep in that 50 to 80 category. It's absolutely better for the prevention of a whole variety of diseases. Let me give you just a few more examples. A complete blood count. A complete blood count has a bunch of different tests. It has your total white blood cell count, your total red blood cell count, and all of the things underneath. But I'm just going to give you one example of the healthy ranges versus the clinical ranges in the complete blood count, otherwise known as the CBC. For example, the normal range for a total white blood cell count is 4,500 to 11,000 cells. And the optimal is 4,500 to 9,000 cells. That way, with the tighter, healthy ranges, you're going to pick up problems earlier than if you waited for things to become so bad that they are then finally out of the normal range. Blood glucose, this is a very important one. When you get a blood sugar test on your glucose, that's your glucose at the time of the test. And the normal range for blood glucose levels are 70 to 99. The literature shows that a blood sugar level even if it's not fasting, should never be greater than 85. If it's greater than 85, it predicts that another test, which is a several-week average of blood sugar called hemoglobin A1C, will likely be abnormal. And I can tell you from my experience over the course of decades, that is absolutely true. And this was written up in the Journal of Endocrinology, if I'm remembering correctly. So we don't just want to be in the normal range for glucose, we want to be in 85 or lower. For more information on blood interpretation, absolutely check my website at drmichaelwald.com. Search the search bar for any test name that you're interested in, or just blood interpretation or healthy ranges versus clinical ranges. There's a ton of information on this because that is my main focus as the blood detective. Thank you, everyone, for listening to today's show. I hope it will change your perspective on laboratory work. Once again, my name is Dr. Michael Wald, and I'll see you next time on Ask the Blood Detective.